Welcome to today's episode of Nursing Theory Unveiled. Today, we will have healthcare professionals with us to deep dive into the theories that shape the modern nursing practice. In this episode, we'll be exploring Dorothea Orem's self-care deficit nursing theory, a foundational concept that has revolutionized the approach to patient care. Hi! Have you ever wanted to be a nurse?
Actually, yes, because my aunt inspired me to become one, and she's in the medical field, so nurse.
So you want to introduce our guests for today?
Okay, so for today, we are joined by two remarkable guests with extensive experience in healthcare. First, we have Dr. Dorothea, a renowned physician with over 20 years of experience in chronic disease management. Dr. Dorothea is not only a practitioner, but also an accomplished author, having written several books on patient-centered care and self-management of chronic illnesses. Dr. Dorothea, it's a pleasure to have you with us today.
Thank you. I'm excited to be here and to explore how this theory influences the way we manage chronic diseases in medicine.
Would you prefer us to call you Dr. Dorothea or Regina?
I'll be more comfortable with Dr. Dorothea.
Okay.
And now, we're equally excited to hear your insights. Joining us as well is Nurse Espino, a highly experienced nurse who has spent over 15 years in patient education and rehabilitation. Nurse Espino has also published research on the role of nursing in patient empowerment and regularly speaks at international nursing conferences on this topic. Thank you for joining us.
I see you well and healthy. Thanks for inviting us in your beautiful studio.
Let's kick things off by diving into the origins of Orem's theory. Dr. Dorothea, can you tell us a bit about the historical context in which Dorothea Orem developed her self-care deficit nursing theory?
Absolutely. Dorothea Orem developed her theory in the 1950s and 60s, a time when nursing was primarily task-oriented. Nurses were seen mostly as caretakers who carried out doctors' orders. Orem saw that something was missing. Patients often left the hospital without the skills or knowledge to manage their own health, which led to recurring illnesses. This inspired her to create the self-care deficit theory. I remember a patient who had COPD, chronic obstructive pulmonary disease. He'd been in and out of the hospital multiple times because he didn't fully understand how to manage his condition. Once we adopted a self-care approach, involving both education and regular follow-up, his hospital's visits decreased dramatically. Orem's theory really filled the gap, emphasizing patient empowerment through knowledge.
Nurse Espino, from a nursing perspective, how did Orem's theory change the way nurses approach patient care?
Her theory was transformative. Before Orem, nursing was very task-based. Orem shifted the focus to emphasizing patient autonomy. She argued that nurses should help patients regain their independence, which was a game changer for chronic care and rehabilitation. I remember a patient I had early in my career, a man who had suffered a stroke. Initially, he needed assistance with basic tasks like eating and dressing. But over time, as we worked with him, he began regaining control. We moved from fully compensatory care to teaching him how to dress himself, using adaptive tools. By the end of his rehabilitation, he had regained much of his independence. That's what Orem's theory is about, giving patients the tools and knowledge to reclaim their lives.
That's a powerful story, and it really shows how this theory applies in real life. I've heard that her work is actually made up of several interrelated theories. Could you tell us more about these?
Yes, that's correct. Orem's work encompasses three interconnected theories. The first is the theory of self-care, which explains how individuals can and should take care of themselves. The second is the theory of self-care deficit, which looks at situations where a person cannot carry out their self-care and requires nursing intervention. And finally, the theory of nursing systems outlines how nurses can provide the care needed, whether it's fully compensating for the patient's inability, supporting them, or educating them to regain independence.
It sounds like your theories really transformed the role of nurses from simply caring for patients to empowering them. Can you please elaborate on the three interrelated theories and give us examples about each of them so we can better understand what they mean? Let's start with the first one, the theory of self-care.
So, theory of self-care, as you said, this is about what people do to take care of themselves and stay healthy. It includes everyday activities like eating well, exercising, and getting enough sleep. For example, a healthy person may cook healthy meals, go for walks every day, and take time to relax. This is self-care because they are actively looking after their own health.
That sounds like something that's so easy to do, but it does require some discipline, doesn't it? What about the second one, the theory of self-care deficit?
This happens when someone can't take care of themselves due to illness, injury, or age. They need help to manage their health, someone to look after and take care of them. For example, a person who is recovering from hip surgery, which is very painful, will require help with their activities of daily living. They might need assistance from family or caregivers to help them during their recovery. This is what self-care deficit means. A person who needs help to meet their own health and care needs.
That is a really good explanation. Now down to the last one is the theory of nursing systems.
Nursing systems. This theory is about how nurses can help those who can't take care for themselves. It includes teaching, supporting, or directly helping people to improve their self-care. For example, a nurse helping a diabetic patient can show them how to check their blood sugar, plan healthy meals, and how to know when their sugar levels are high or low. The nurse may also help with insulin injections until the patient can do it on their own. Nursing systems are all about how nurses provide care and support based on what the patient needs. The main goal of this theory is to make sure patients feel supported and be knowledgeable on how they can improve their well-being.
Those are excellent examples. This just shows that nurses are not just healers. They also serve as educators in helping patients understand their health and guiding them in taking care of themselves.
For this part, we're going to have Dr. Ignace and Nurse Herrera with us who has been in the medical field for several years already. Let's move on to the core principles of Orem's self-care deficit nursing theory. Nurse Herrera, could you start by explaining the key concepts that make Orem's theory?
At its core, Orem theories is about recognizing when a person can no longer care for themselves and understanding the role that nurses play in helping them regain the ability. She identified three key components: self-care, self-care deficit, and nursing systems. I've had a patient with diabetes who didn't fully understand how to manage her condition. She constantly coming back to the hospital with complications. Once we implemented a self-care plan, focusing on her diet and insulin management, her hospital visits dropped significantly. We taught her how to count carbs, manage her insulin, and even how to recognize the signs of hypoglycemia. Over time, she became confident in managing her condition on her own, which is a perfect example of Orem's supportive educative care.
From a medical perspective, what I love about this theory is how it aligns with patient education. I had a patient with hypertension who kept returning with uncontrolled blood pressure. It wasn't until we implemented a self-care plan that included daily monitoring and lifestyle adjustments that he saw real improvement. The nurse played a huge role in educating him about proper salt intake and physical activity. The key wasn't just treating this disease but empowering the patient to manage it.
That's a great point, Dr. Ignace. It sounds like Orem's theory isn't just about nursing. It's really a collaboration between nurses and physicians.
Exactly. I've seen this in action too, especially with diabetic patients. There's one case where the patient was a young woman who didn't know how to balance her diet or manage her insulin correctly. We worked together over several months, teaching her how to count carbs and monitor her glucose. By the end of the year, she was confident enough to manage everything on her own. which reduce hospital visits significantly. That's the essence of supportive educative care.
Thank you so much for joining us today.
Let's shift gears now and talk about how ARMS theory is applied in modern healthcare settings. Dr. David, could you give us an example of how this theory is used in medical practice?
Certainly, one great example is in heart disease management. I had a patient who needed to make significant lifestyle changes after a heart attack, monitoring blood pressure, changing diet, exercising, and taking medications regularly. Initially, the patient was overwhelmed and relied entirely on the healthcare team. But with time, using ARMS model, the nurse educated him on how to use a blood pressure cuff, track symptoms, and understand medication side effects. After 6 months, the patient was able to manage most of his health independently.
That's a fantastic real-world application, Dr. David. Nurse Peñaveral, how about in rehabilitation settings? How does Orem's theory play out there?
Orem's theory is incredibly relevant in rehab. For example, I worked with a young man recovering from a severe car accident. At first, he couldn't walk or even feed himself. We started with wholly compensatory care, doing everything for him. Over time, we will move into partial compensatory care, teaching himself how to stand, balance, and use a walker. Eventually, he transitioned to supportive educative care and he practiced these skills independently, with us providing only guidance. By the end of his stay, he could walk short distance without pain. Watching that transformation through the lens of Orem's theory was incredibly well.
It's clear that ARMS theory is incredibly flexible and adaptable. Now, Dr. David, with the rise of telehealth and digital tools, how do you think ARMS theory fits in today's tech-driven healthcare landscape?
Telehealth is a fantastic complement to ARMS theory. By the way, it's an app to those anyone who needs tracking their health. Highly recommended. I recently had a patient with COPD who lived in a rural area. We used telehealth to monitor his symptoms and provide education on breathing exercises. The nurse would check in regularly via video call to ensure he was adhering to his care plan. Using this technology, we were able to implement Orem-supported educative care remotely. It is a great example of how technology can empower patients to take control of their own health.
I've had similar experience. Technology allows us to reinforce self-care principles. I worked with a diabetic patient who had trouble keeping track of her medication. Using a mobile app, we set up reminders for her. The app even logged her glucose readings, which she shared with me via telehealth. It was an ideal way to extend Orem's model into the digital age, making self-care more accessible.
Okay, so in summary, Dorothea Orem's self-care deficit nursing theory emphasizes the balance between patient autonomy and nursing support. By understanding when to step in and when to teach, nurses play a vital role in empowering individuals to take control of their health. This theory continues to guide nursing practice and patient care, making it as relevant today as it was when Orem first introduced it.
Absolutely. It's a theory that really bridges the gap between medical treatment and long-term patient health management.
Yes, and it empowers both nurses and patients. We're not just there to provide care, we're there to teach, support, and enable.
Thank you, Dr. David and Nurse Peñaveral, for sharing your expertise and real-world examples. It's clear that Orem's theory isn't just an academic concept, it's a practical, empowering model that benefits both healthcare professionals and patients. To our listeners, if you found this episode insightful, don't forget to subscribe for more in-depth discussions on the theories shaping modern nursing practice. Until next time, take care and stay empowered.
Bye! Magbay na kayo.
Yan na yung part